Welcome back to Great Day Medical Monday. Well, there is a reason why there are so many specialties in medicine. We want experts to know all about our specific health issues. Our next guest makes it his mission to help people suffering with neuropathy. It's the first time Jim McCord has found relief after 5 years of searching. Welcome back, Dr. Baltai and Alina Sohel with Advanced Nerve and Health Center and their patient, Jim. All right.
Morning.
When I say you specialize in this, you set out to really understand what neuropathy is. So many people have been to doctor after doctor after doctor, received treatments from, here, take this medicine, I hope it works, and not gotten any relief. You want people to trust what you're doing, trust the process.
Right, so I spent a good portion of my career really diving into neuropathy and figuring out, why do people continue to suffer? Why is the standard of care so bad that when somebody has neuropathy, they always get worse? And worst off, they're left to fend for themselves.
Yeah.
And to me, that's not good enough.
Yeah.
Because life is short enough as it is. We recently had a death in our family, my wife's uncle, and he had it from cancer. But looking at how short life is, and that every moment you have to make it worthwhile.
You have quality of life.
Absolutely.
Yeah. And Alina, by the time a lot of people show up to you, they feel defeated.
Right, and that's the important part, is that we want to provide that hope. They are able to get help, and we want to be able to provide that.
Yeah. All right. So Jim, what were the early signs that something was going on with you?
Numbness. Sort of my ends of my feet started getting numb.
Yeah.
And I went to a doctor, and he said, well, tall people have that. I'm 6'7".
Yeah. Okay.
And so that's an issue.
Sorry. Yeah, tall people have that. Okay.
And that was it. And then it kept progressing and getting worse, and it felt like I was walking on marbles.
Yeah. Did they give you a name for it at the time?
Neuropathy.
Okay. So you said neuropathy, and of course your next question as a patient would be, what can we do with it?
Then what do I do? So I went to a neurologist, and they said, yes, you have neuropathy. They, did the test and everything, and anything I can do? Nope, not at all. Not at all.
Yeah. All right.
And so living with it over and over and over, just, my quality of life was not very good.
Yeah. So you started kind of searching around. You saw a segment on a YouTube channel. Go ahead and tell people what that was.
I saw your segment.
Yeah. Actually, you saw Dr. You saw their segment,
yeah,
right?
They were on it.
Yeah.
And they, Dr. Ty explained it, and Elena, and everybody explained what they did. And I thought, well, man, I should give them a call.
Yeah. What was it that made you decide to go ahead and give them a call? Because as we said earlier, so many people have seen so many things and been let down. What was it they said that made you think they can help me?
It sounded like they were having success. They had some really good examples. They had some people that were being helped by your treatments, and it didn't hurt to try.
Yeah.
I mean, if it didn't cost me anything really to go in and get assessed, why not do it?
Yeah, we're going to find out how you're doing in a second, but let me start for all the other people out there who are saying I have some numbness as well. Elena, what are some of the other symptoms that people may indicate that they have neuropathy?
Right, so usually it is numbness, tingling. They'll feel like they're walking on pebbles or hot rocks. Pulling the sheets over at night causes them a lot of pain, so you're losing sleep, and then you're just tired all the time because your muscles are tired as well.
Yeah, yeah. What causes neuropathy?
Right, so it is damage to the nerve itself. Now, we know that diabetes...
Tall people have that.
Tall people have that. If you're anything over, 6'5", yeah, you'll get that. But, from diabetes, chemotherapy, circulation-related issues, essentially, there's damage to that nerve. Think of a nerve as like a wire or electrical cord. And what we've done now is you've sliced off the top of it to where all those wires are exposed to the environment. Well, in your body, as that happens, these nerves now malfunction. And as they malfunction, you start to lose motor and you start to lose sensory, which is movement and feeling.
Yeah, you've had people come on here who couldn't walk and then now can walk.
Yeah.
Okay. If you suspect that you have neuropathy, you use the acronym ACT.
Yes, so ACT. First is attention. Pay attention to what's happening, right? Start collecting the details. Does it happen at night? Does it happen in the morning? How bad is it? Where does it stop? Where does it radiate to? Because that's the information myself and Alina that we need to now to really dive into what's happening. The second is C for circulation. You gotta get more blood flow to that area. A nerve is like a plant. A plant needs water for it to grow. A nerve has to have oxygen and blood for it to stay alive and for it to flourish. So exercise, massage therapy, anything you can do to get more blood to that area, fantastic.
Yeah.
The last part is T for treatment. You have to now achieve natural nerve regeneration. You gotta repair that nerve, otherwise it will just die. Yeah. And so our process revolves around accelerating the body's natural ability to now heal that nerve, producing very specific proteins that gets the nerve to repair and fix itself a lot faster than it normally would, because as you get older, it doesn't work as well.
Yeah, yeah. Okay, it's interesting because it's not a one-size-fits-all treatment either.
Right.
And Alina, what you do is you sit down with that person and you listen to what they have to say in all those areas that Dr. Tai was talking about.
Exactly, and it's really important, just like Dr. Tai said, if you start noticing these changes, noticing when it's painful, when you're feeling numb, we're able to assess that and create a treatment plan that's specific to each patient.
All right, so what's happened with you so far?
So since April, when I came in, I was really struggling, I think, after being assessed. And since then, I've started walking a lot. So I've joined a gym. I've walk about 1.5 to 2 miles a day, or at least try to, as much as time permits. The feeling is way, way better for me. I used to not, I would intentionally not go to lunch very far from my office. I work in the downtown area, so I would stay in the tunnels very close because of walking. It would just hurt too much. Now, I don't care. I'd rather walk.
Yeah. And restoring that quality of life. But what that also tells you is that it is not just dealing with that exact nerve, but it's actually reversing the damage from the other nerves.
Right, absolutely. So when you have somebody who has these symptoms, right, and then now, just like Jim, they're way better, which means that nerve is now functioning and repaired itself to a certain degree. So now what we can do is figure out, hey, how do we keep Jim this way? What are the things that we need to do to keep Jim walking, to make sure his balance stays strong, to continue to increase his quality of life?
Yeah, all right. And the great thing about this is that non-invasive,
Yes.
pain-free,
Yep.
and what I also love, and I think we're trying to move more toward this in medicine, is that the patient is your partner. We don't just come and lay it out on the table and say, fix me. The patient is the partner.
Yeah, when patients come in, they'll meet with Alina and really take a deep dive, and we figure out, hey, not only what is your symptoms, but what are all the different things that are contributing to it? Whether stress, whether nutrition, whatever it is, because if you really truly want to make a change, you have to take away all the things that are causing that problem. Because if you deal with just one component, you're never going to get enough momentum to actually get better. And that's the problem that most people have.
All right, Alina, you're at which office?
The Houston office. So
Okay.
Yeah.
Houston
Come and
office,
see us there.
and that's the one, Katy Freeway, right?
Yes.
Near
Yes.
I-10 and
That's
Voss. All right, so come in, ask Alina. Alina can
go.
help you
Alina.
figure out what's going on, and your advice to anybody who is struggling, because unfortunately, this is one of those things that's degenerative, right? If you just don't address it, things most likely will get worse.
Absolutely, yeah.
Yeah.
Yeah, it's not going to get better on its own.
Yeah.
It just doesn't.
So best advice to somebody who's hesitant about coming in.
Call. Just take a chance. You don't know,
Yeah.
and just ask Elena.
Yeah, there you go.
Yeah.
All right, Dr. Tai of the Advanced Nerve and Health Center has a special offer for Great Day Houston viewers. The first 17 callers will get an in-office consultation, a copy of Dr. Tai's Healthy Diet to Heal Nerve Pain book, and a diagnostic nerve test to see if they can help you. Get all of this for just $39. Call Advanced Nerve and Health Center now at 832-626-1260, 832-626-1260. And for more information, log on to nerveandhealth.com. Thank you very much.
Thank you.